Hey everyone, welcome to today's Explainer. We're diving into a massive shift happening right now in health and wearable technology. Look, for years, we've all been wearing these smartwatches and rings, dutifully checking our sleep scores every single morning. But today, we're moving beyond just passively monitoring our bad sleep. We're setting the stage for the era of actively fixing it.
Let me ask you something, and I bet a ton of you can relate to this. Are you absolutely exhausted staring at your phone over your morning coffee while your expensive smart ring helpfully informs you that you slept poorly? Yeah, you already knew that, right? That feeling is what we call sleep tracker fatigue. It's that incredibly common frustration of having mountains of data about your terrible sleep, but absolutely no actionable way to actually change it.
Section 1. The Passive Tracking Problem.
So right now, we've got a core issue in the wearables market. On the left side here, we have passive tracking. Most wrist trackers and rings, well, they're really just inferring your sleep stages by looking at your arm movement and your heart rate. It's basically an educated guess. But on the right, we have active brain monitoring using clinical-grade EEG or electroencephalography. This directly measures the electrical activity of your brainwaves, and in sleep science, EEG is the absolute gold standard. Because, let's face it, sleep doesn't happen in your wrist. It happens in your brain.
Section 2. The Science of Active Sleep. Let's look at how technology is actually stepping in to change those brainwaves.
The crucial concept here is closed-loop auditory stimulation, or CLAS. Now, I know that sounds like a total mouthful, but it's actually an incredibly elegant biological hack. CLAS involves delivering perfectly timed, really soft sound pulses, like little auditory tones, that align exactly with specific phases of your brainwaves while you sleep. Think of these sounds as gentle little nudges that keep your brain locked in a deep restorative state. And the best part is, they do it without ever waking you up.
Okay, so here's how this seamlessly breaks down into 3 steps. First up, the system uses those EEG sensors to detect the exact moment your brain enters slow-wave, deep sleep. Second, the algorithm anticipates the precise peak, what scientists call the up phase, of that slow brainwave. And third, right at that microscopic fraction of a second, it plays a tiny 50-millisecond pulse of pink noise. That little sound essentially acts like a rhythmic drumbeat that your brain syncs up with, literally deepening your slow-wave sleep. It's like a perfectly timed push on a swing. And this science is rapidly moving out of the laboratory. Companies like Tosoo are rigorously researching these non-pharmaceutical methods. Their ultimate goal is to shrink all that bulky hospital equipment down into a single wearable device. They want to bring enhanced physiological sleep and recovery directly into your home. Section 3. Enter the EEG Smartbud. So, what does this actually look like in a real consumer product today? Let's break down the NextSense Smartbuds. These things pack an astonishing 6 clinical-grade dry EEG electrodes into a tiny earbud. They use these soft, flexible sensors coated in a special material called Tectocoat, which maintains a secure electrical connection with your ear canal all night long. Now, instead of streaming music over Bluetooth, which would totally kill the battery, they play those local slow-wave auditory stimulations right from the device's own memory. Currently, this impressive tech does require an iPhone 12 or newer running iOS 17 or higher to handle the heavy algorithmic lifting on the app. But essentially, they're bringing a multi-million-dollar sleep lab straight to your bedroom.
Looking at the broader market, NextSense positions itself firmly in the luxury health tech tier. At a retail price of $399, though they do have a $249 early bird tier, it sits slightly higher than passive trackers like the Oura Ring Gen 3 and significantly higher than pure noise-masking sleep earbuds like the Soundcore Sleep A30. But the key claim here is entirely different. They aren't just blocking noise or tracking your heart rate. They are claiming to actively intervene and actually improve the quality of your deep sleep.
Section 4. The Reality Check. Before we throw out our sleep masks, let's look at the objective reality. Tech reviewer James Perrow over at Gizmodo perfectly captures a major hurdle. He notes, when you brush up against the pillow with a wireless earbud in your ear, you can hear it. There's no getting around the fact that these are better suited for people who sleep on their backs. The reality is, packing 6 advanced EEG sensors and audio drivers into an earbud inherently adds some bulk. And size means potential discomfort when your head is pressed sideways into a pillow for 8 straight hours. I mean, side sleepers, you know exactly what I'm talking about. So we really have to balance the scales here. The pros are genuinely fantastic. The setup is surprisingly easy. The earbuds boast an incredible 9-hour battery life because they play audio locally rather than streaming, and the EEG data is lab-quality accurate. But the cons are very real physical and practical hurdles. Like we said, they can be pretty uncomfortable if you sleep on your side. Early users also reported some annoying software pairing glitches right before bed, not what you want when you're trying to wind down. And perhaps most importantly, there are hidden recurring costs.
Yep, there is a hidden catch: $15 a month. NextSense requires a FitKit subscription to regularly replace the silicone wings and ear tips. Why? Well, because that special Technicoat material that allows the EEG sensors to read your brainwaves actually degrades over time from the natural oils in our skin. So to keep that clinical-grade signal intact, you have to buy fresh tips every month. It's definitely an ongoing cost you need to factor in to keep your biohacking hardware functional.
Section 5. Benefits for everyday people. Let's pivot and look at exactly what's in it for the common person who just wants a better morning.
The benefits of extending your slow-wave sleep go way, way beyond just a higher sleep score on an app. For everyday folks, this translates to waking up without that heavy, awful brain fog or grogginess. It actually enhances memory consolidation and learning, so you might finally remember your grocery list or that new system you're learning at work. Notably, it provides a powerful non-pharmaceutical alternative for people trying to ditch prescription sleep meds. It's even been shown to increase heart rate variability, or HRV, which is a key marker for cardiovascular health. And financially, they are HSA and FSA eligible, meaning you can use pre-tax dollars to buy them, effectively saving 30 to 40%. That's a huge win.
And the real-world results are pretty compelling. In a 106-night beta test, 50% of NextSense users reported better or much better sleep. Now, the other 50% saw baseline or different results, so, it's not a magic bullet for every single human body. But think about it. If you are among the millions of people suffering from chronic poor sleep, a 50-50 shot at noticeably better morning recovery without taking a pill, that's a massive leap forward.
Of course, we have to address the elephant in the room: privacy. The whole idea of brain hacking sounds a little sci-fi and terrifying, right? But NextSense makes it crystal clear. EEG detects patterns of sleep depth. It does not read your thoughts, your memories, or your secrets. Your brain data is 100% yours, it is heavily encrypted, and sharing that data back to the company is turned completely off by default. So your mental privacy is strictly protected.
Section 6. The future of brain tech. Let's look ahead, because sleep is really just the first frontier here.
Fascinating research from Chalmers University shows where this is going next. Imagine earbuds that feature real-time sleepiness monitoring. Researchers have tested dry electrode systems that can run for up to 40 hours continuously to detect driver fatigue and potentially prevent catastrophic highway accidents. Even more profound, because neurodegenerative diseases like Alzheimer's and Parkinson's actually change the architecture of your sleep years before other symptoms appear, these earbuds could eventually serve as early screening devices. By combining this tech with AI to auto-detect those brain patterns, your headphones could literally become a continuous, proactive health guardian.
And the medical community is taking this incredibly seriously. Right now, major institutions like Emory University are running official clinical trials validating these exact kinds of EEG earbuds and smart glasses against full-scale hospital sleep labs. We are rapidly moving away from just consumer wellness gadgets and stepping into validated therapeutic applications and personalized cognitive enhancement. It's a real game changer.
Which brings us to our final thought. As we move from passively tracking our terrible sleep to actively fixing it through brain stimulation, if an earbud could literally hack your brain to banish exhaustion and give you a perfect night's sleep, how much is that rest truly worth to you? It's a fascinating choice between comfort, cost, and cutting-edge science. Thanks for tuning into this explainer, and keep learning.